Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir, and I'm here at the JWC studio. And today I've got one of our leading cardiologists from the hospital, from Jehangir Hospital, Dr. Ajit Mehta. Thank you so much for being here, Doc.
Thank you.
So, Doc, I've got many questions. First of all, I've got many jokes lined up about hearts and puns about the heart. But before we get into the heart of the issue, I would like to ask you, how did you get into becoming a cardiologist? Because it's not something that when you wake up as a 5-year-old or 6-year-old, you wake up thinking that I'm going to become a cardiologist. So how did you get into this space?
Honestly, I also had not thought about becoming a doctor
Right.
initially, but my dad always wanted to become a doctor.
Okay.
Because of, he couldn't become a doctor. He saw me becoming a doctor, and then I thought I would pursue my career in medicine. And after doing my MBBS, I did my MD medicine, and then I always had a passion for cardiology. So when you are learning, when you're doing your medicine, there are multiple subjects you
Right.
undertake, and out of that, cardiology was one of my favorites. So I thought might as well go ahead and do my cardiology.
Right. Okay.
And I'm glad that I did my cardiology because if you're passionate about your work, what you do, it keeps you going all throughout.
Absolutely,
That's the
yeah.
most important thing. And then I'm happy that I'm here.
Yeah, absolutely.
Cardiologist today.
And it's a lovely field to be in. I mean, it is one of the most popular ones, when someone as a layman even thinks about their own health. They're always thinking about how their heart is and cardiac, their cardiac health. So it is the most popular one, so to speak, in people's minds when they think about their wellness.
I think
So
I think I would give credit to media also because they are making
Right.
people aware of particularly heart health. Of lately of last decade or so,
Yeah.
because we are losing a lot of young lives for a sudden
Yeah,
cardiac
absolutely.
death, heart attack, probably not even reaching the hospital. So the media is doing a lot of good work
Yeah.
of making people aware what heart health is,
Right.
how one should take care of his heart, what should be a diet, exercise,
Yeah.
and so on.
That's a good point because actually this is a question I was going to ask you a little bit later on, but since you brought it up, I thought it would be a good time to bring it up now. Actually, is that as you said, the media lately, and you have been reading more and more stories of younger people, having heart attacks and unfortunately even losing their lives due to that. Now, is that a trend that you're actually seeing in the space as you treat people, or is it media fad, or what is happening here?
No, I think we are definitely seeing the surge in, increased incidence of cardiac events,
Yeah.
a heart attack, sudden cardiac death in younger individual, especially in last 2 decades or so.
Right, absolutely.
And it has been seen that, the genetically Indians, especially, are very prone to get a younger the heart attacks, heart attacks at much younger
Really?
age. Yes, and then there has been study also where the Indians who are kind of a settled abroad in 2 or 3 generations, vis-a-vis the Caucasian population,
Yeah.
the incidence of the heart disease were much higher in those people also.
Oh, really?
So let's say your people who are staying in Western countries for 2 or 3 generations,
Yeah.
all those diet, the environment has taken care of is the same for both the population. But at the end of the day, it's Indian genetics which is giving them or making them prone for a higher incidence of the cardiac events.
Okay.
And that also comes because of so many other issues like, inappropriate diet,
Yeah.
excessive smoking, tobacco, excessive alcohol, rapid urbanization. So people really want to, follow this, modern lifestyle very soon without, taking efforts to do any kind of physical activity.
And sleep gets compromised as
Sleep is
well.
compromised. Social media, people are on the mobile or the
Yeah.
internet for a long time.
So what can we do to prevent that kind of thing, or best of our ability to try and prevent these things?
So the first and foremost, what I believe is the awareness. We have to spread the public awareness
Yeah.
by whatever means possible. Media is the best way to go ahead, promote healthy lifestyle among
Right.
everybody. From kids. I mean, I personally feel it should start from a school days.
Okay.
That how one has to adopt the healthy lifestyle from school.
Right.
Most of the Indian, what has been seen, have been physically inactive. They lead sedentary lifestyle.
Right.
I mean, there are multiple other issues also related to that. We just can't take one thing directly. Like people have to travel from one place to another to the office, to travel
Yeah.
distances, no time for their personal workout, or probably come back late from the office. So they have no time for doing physical activity.
Right.
They are stressed out. The stress could be anything. It could be financial, office related,
Right,
stress,
that's
so many
right.
other things. So I think the awareness how one has to take care of his health is very important.
Health checks.
Health checks, of course, it goes without saying.
Yeah.
Health check is one thing which is really come up recently very well.
Yeah. But a lot of people, sorry to interrupt you, Doc, but a lot of people think health checks and they only do blood tests and so forth. What would you like to see that people cover in their health checks that make sure that holistically everything is covered, that make sure specifically for the heart?
So, as per the cardiologist,
Right.
when we talk about the health checks, and especially people beyond 35, 40 years of age,
Okay.
we look at the comprehensive health check packages.
Yeah, yeah.
We do lipid profile, the cholesterol levels, the
Which is
sugar
the blood
levels,
test, through blood test, okay.
do all the blood tests,
Right.
comprehensive blood tests,
Right.
and importantly, ECG, echocardiography, stress test. These are the preliminary.
Stress test is the one that people run on treadmills, right?
Treadmill. So these are all preliminary basic investigation one should undergo.
Yeah.
And if you come across some defects, some problems in this test, probably you should visit a cardiologist or
Yeah.
a physician and probably take it up to the next level.
Right, yeah.
So doing this regular checkup beyond 35, 40 makes sense, because what we have always been taught, diabetes and high blood pressure or a cholesterol problems are the silent killers. They don't surface unless patient have problems or complications.
Right.
Before they cause a complication, might as well detect them before
Yeah,
and
absolutely. You're preventing it.
preventing it. So
Yeah.
what we call is a primary prevention.
Absolutely.
Doing that makes more sense, I believe.
And one story that perhaps you can shed light on also is a lot of people have this conception that you put in a stent or something like that only as after an event or something like that. Whether you had some kind of cardiac event. But I know of a case where it's been done as a preventive thing. For example, you were saying someone who does their health checks every year and these kind of parameters came up. Okay, you've got a heart issue, you've got a certain blockage that you just have to keep an eye on. Now, every year that person was doing their health checks with all these parameters that you talked about every year, 4 or 5 years, and then after the 5th year, they said, okay, now we've seen that blockage gone from whatever it was, 10% to 30% or 60% now. Maybe it's a good time to do an angiogram. You can explain to us what an angiogram is later, perhaps. And then they did that angiogram. They was like, yeah, okay, maybe it's a good time to put in the stent just to make sure that everything is okay. So that person put in that stent just while they were on the table.
Right.
And it was a purely preventive thing. It wasn't like, oh, they collapsed or they had a heart attack or anything like that. It was purely, literally a preventive thing that was taken into consideration. So that was something new for me, that even something that what you would think is a emergency situation was done as a preventive.
So this is the beauty of doing regular health checks.
Right.
The beauty of doing it, you diagnose the problem, upcoming problem well in advance before something really crops up.
Yeah.
Person who is going to get a heart attack, say 6 months down the line, and you're done investigations 6 months prior, so that person's echo is not normal or ECG has some problem, or you do a stress test which is positive. Patient is not experiencing much symptoms because patient is otherwise sedentary.
Yeah,
He's
exactly.
not walking much. So he's not going to experience those cardiac symptoms unless he does some activity. And if he's not experiencing those symptoms, it doesn't mean that patient does not have a problem. So those problem gets highlighted or probably come into light after you do regular health check packages.
right.
And if you do that, the stress test is positive. And if patient has a symptom, probably we take it to the next level, what we call is an angiogram.
Right.
So angiography is a test where we nowadays we have got a beautiful radial lounge at Jehangir Hospital.
Right.
So
What is a radial lounge?
traditionally most of the angiographies have been done from femoral root, that is through the thigh, artery in the thigh.
Okay.
So from the leg side.
Wow.
And
it goes all the way up?
patient has to absolutely. So patient has to be immobile for 6 to 8 hours. He cannot move around.
Right.
Sometimes the complication of the femoral artery punctures are very
Right.
disastrous. So nowadays, last decade or so, what we have been doing, we are doing all the angiographies through the wrist. So from the radial route, from the hand.
Okay.
So it's much more comfortable, convenient for the patient.
Less distance. I
Less
guess.
distance.
I don't know whether that helps or not. I just
Not
to
really.
layman that
It's
thing.
basically more convenient for the patient.
Okay.
Patient does not have to be immobile for 60 hours.
That makes sense.
Complications are low. It is easy on patient. Patient can move around
Yeah,
immediately
yeah.
after the procedure. And we are started having a radial lounge at Jehangir Hospital where immediately post angio patient can walk to the radial lounge, sit in the lounge chair, comfortably have the food, tea, coffee, and
Really?
go home in a couple of hours time.
So they can do this kind of procedure like a stent or
So
something like that, and then
angiography, as you know, you must have heard people go to do a sonography or
Yeah, yeah.
breast test, come back after doing it for a couple of hours.
Yeah, they have
They
to
will
be fine.
send patient home in 2 hours after the angiography. So
Wow.
it has no longer remain a kind of a big procedure or
Okay.
something to be really scared of.
Yeah, yeah.
So a person who has a positive stress test undergoes an angiogram. We find a blockages which is significant, so
Right.
more than 70-80% blockages.
Hmm.
So more than waiting for heart attack to come in, and then a patient coming in an emergency situation in the
Yeah.
middle of the night. If patient has a positive stress test, a significant disease on angiography, we go ahead, discuss with the patient, and go ahead and put in a stent. So in a way, we are avoided patient getting a heart attack in times to come, because patient has done preventive
Exactly. Coming
checkup.
back to that same example, right?
Yes. So patient has done a preventive checkup. We have further gone ahead in angiography. We confirmed that there is a problem and fixed with the angioplasty.
Fantastic. Okay, Doc, moving on to a different type of question that I'm sure everybody has an opinion on and would like an answer of. Can I have red wine every day with my food? Is that good for my heart? Is that bad for my heart? Everyone wants to know.
So people who drink alcohol, I would say anything in moderation is okay.
Yeah.
But as far as heart health is concerned, it is not mandatory for a person to have alcohol,
Yeah,
be it red
definitely.
wine or a hard drinks. I mean, whiskey or any other drink. So it is not mandatory. Somebody cannot start drinking alcohol saying that it is good for my health.
Yeah. So it is a myth. People that think
Yeah.
that having a red wine a day is good for you.
Not really. I mean, of course, it is not bad. If you take anything in moderation, it is not bad. It's not going to really have any adverse effect
Right.
on
Yeah.
your
Yeah.
heart.
No, moderation.
But unfortunately, it doesn't remain moderation after a few months.
Yeah. I mean, exactly. I mean, someone can say I'm having a red wine a day, and that can be a bottle.
So anything
Which
in
is a-
moderation, which is, I think for females and males, there are allowed units to be consumed.
Yep,
So
yep.
if you stick to that, probably that's not a bad thing. But it does not mean that a person has to start drinking alcohol
to feel better or to improve
Absolutely.
their heart health. But okay, that's on the drink side. What about food side? Is anything that people should absolutely avoid as if they do have heart issues or even if they don't have heart issues?
So, as far as food is concerned, the most important thing is that we should try and avoid oil of any form, oil in any form.
Really, of any form.
No, in the sense, moderation. Again, the
I
key
suppose
here-
ultra processed food and those kind of things is what we want to stay away from.
Anything, here, when we talk about any health related benefits, it comes with whatever you consume. It has to be in a moderation. So even if you're having oil, butter, cheese, ghee, I mean, there are various terms what have been used.
Okay.
So everything has to be in moderation, as low as less as possible.
Okay.
That's the most important thing. Saturated fats
Right.
should be least consumed. The processed food, again, should not be used very often. Fried things should be avoided.
Okay.
But apart from that, the legumes, the wheat products, all those things are not a problem. So everybody should have good amount of fruits, salad in their diet.
So greens, everyone should have their vegetables.
Green leafy
Yeah.
vegetables, salad, a lot of fruits.
Got it.
All those things should be there. So
Okay.
there is a beautiful picture what we have in our department, a pyramid of diet. So in the
Pyramid of the diet.
diet pyramid,
Okay.
so at the bottom of the pyramid, what you should have frequently, regularly, and in good amount is all the legumes, lean meat. I mean, not meat. I mean,
Yeah. Is dark chocolate on there?
dark chocolate. is there.
All right.
But again, in moderation. So, on the upper, when you consume little less quantities,
Yeah, of course.
dairy products, red meat and other
Right.
things, alcohol, smoking should be avoided.
Of
Be
course.
good.
But coming back to you, Doc, I mean, you look like you are a pretty fit guy. And I know that you also have one of the biggest hearts in the hospital as well. But coming back to you, you've seen so many patients in, so many cases over the years and you've got a huge amount of experience. Seeing that, what is the kind of exercise that you do that knowing the kind of history that you've seen with people that you think would be most beneficial for people for heart health?
See, exercise can be just very simple exercise,
Yeah.
because we are talking, we are really trying to give a message to a common people, not everybody is privileged to have a gym facility. So
Yeah.
I wouldn't want to really, just say you go to the gym and do
right?
everything.
No, that's a very sensible
A
thing.
simple, just brisk walking
Yeah.
on road, on the ground is just good enough. So
I completely agree with you.
what I would suggest to everybody, 45 minutes of brisk walking at least 5 days a week.
Okay.
You are busy because on an office front, family front, you cannot do it for 2 or 3 times in a week. That's fine. But at least the rest of 3 or 4 days or whatever 5 days you get in a week, 45 minutes a day, at least 5 days a week, somebody should do exercise.
It's hugely beneficial.
Yeah, exercise could be just brisk walking, jogging, cycling, swimming.
And it's
whatever.
great for the mind as well.
Absolutely.
Big
And then
pressure.
people who are privileged, who can go to the gym, probably a lightweight training also would help them, keep them in shape. And as you rightly said, if you are physically fit, probably you are mentally also very active. And all those positive hormones are very important.
Right, right.
Keep it very simple, more than having a fancy equipments and going
I like
to the
that.
gym only. Just simple
Just walk.
walking is just good enough.
Just keep walking.
Yeah, absolutely.
That's a tagline for someone as well. But so we talked about that earlier, but we'll avoid that for now.
Okay.
But thank you so much for being here, Doc. It's been really insightful talking to you and really, really nice. Your smile is one of the largest, along with your heart in the hospital. So thank you so much for
Thank
being
you
here.
very much for having me.
Thank
very
you.
much.
Thank you all, and see you all next week.